So in today's session, we'll do the chapter of macrominerals. Those who have the textbook, please mention the page number in the chat box, chapter number and page number based on the new textbooks. If anyone is joining late, please help them out with the page numbers. So it's page number 179, chapter 9. So macrominerals are the nutrients that you require in larger amounts. Okay. They should be also a major part of your diet. They should be the major part. Okay. So every day you have to have macromineral rich food. Okay. So calcium, phosphorus, magnesium, sodium, potassium, chloride, sulfur. Okay. These all you require in higher amount. Okay. The trace minerals are the ones that you require only in small doses. Macrominerals in big doses. Okay. Another name for trace minerals is microminerals. Okay, like iron, manganese, copper, iodine, zinc, cobalt, fluoride, selenium. Okay. Last week we have discussed all this. So those you require only in minute amounts. So macros in large amounts your body requires on a daily basis. Okay. So first macromineral is calcium. An adult man of around 60 kilogram has around 1 kg of calcium. The more your weight is, naturally more will be the amount of calcium that is deposited in your body. Okay. 99% of calcium is found in your hard tissues. That is your bone, teeth. Okay. And even your cartilages. They also have calcium. Remaining 1% is in your blood and some soft tissues. Okay. The calcium amount in blood plasma should be within 9 to 11 mg per deciliter. That should be the normal range of calcium in your blood. Okay. But majority of the calcium in your body is found in your skeletal system, your bones, your teeth, your cartilages. Okay. So calcium is essential for bone and teeth formation, as we know. Okay, the main functions of calcium, apart from this, is also muscle contraction. Okay, you pick up your hand, you're able to contract your hand, relax your hand, hold things. Okay, your muscles are contracting, muscles are relaxing. So for normal muscle contraction, calcium is required. Even for your heart. Okay, your heart contracts and relaxes. Okay, and heart also requires calcium ions for this. And also your nervous activity, neurons activity, passage of neurons that require calcium. And blood coagulation, blood clotting, you get hurt, you bleed. Okay, and within few seconds blood clot is formed. Okay, that is because of calcium. Calcium is one of the clotting factors. Okay. So you can see here the bone formation. This happens throughout your life. Okay. It's not that when you are a child, that's when the bone formation happens. You grow into adult, it stops. No. Even right now, as we speak, okay, many parts of your bones are in resting phase. Other parts are in osteoclast phase. Okay. Other parts are in osteoblast phase. Then, then they are in mineralization phase. Okay. It happens naturally. The bone formation, it happens naturally. There is a series of ups and downs in bone formation. Okay. Whenever the blood calcium level goes down, okay, bone is first in a resting phase. You can see here, this resting phase, number 4. Okay. There is a mineralized bone, and on top there is bone tissue. Okay. When it is in resting phase, it has enough calcium. Now imagine your blood calcium level goes down. You are not having calcium rich diet. Okay. Your blood calcium level goes down. So the blood requires calcium because the muscle contraction, heart has to beat, heart has to contract. These are important functions in your body. Okay. So your body requires calcium from somewhere or the other. Okay. The best source is go to the bones. Bones are rich in calcium. Okay. Osteoclast resorption will take place. This is osteoclast taking away calcium, okay, from the bones. You can see here, it was in the resting phase. It was a good bone. Now osteoclasts have started digging up the bone. They have started digging into the bone because calciums have been taken away. Okay. So ossification is this entire bone mineralization phase. The name of it is ossification, bone remodeling. Okay. So every time, anywhere in your bones, this blue color cells that you see on the extreme left, these are your osteoblasts. Okay. Osteo means bone, blast means immature cells. Okay. Always immature bone cells are present. Okay. All over your body, all over your bone, immature bone cells are present, because whenever calcium has been dug out of the bones, that area of the bone has become empty. These osteoblasts have the responsibility to make the matrix and remineralize the bone. Okay. Osteoclast, they do the opposite. Okay. Osteoclast will make sure that the bones are, the calcium from the bones have been taken up. Okay. So that's why this digging into the bone process takes place. It's because of osteoclast. They resorb bone, okay, the bone matrix. Okay. Now there is a empty space here which has formed. Okay. And osteoblast is generally present all over the bones. Now that when there is an empty space in the bone, osteoblasts will get triggered. They have to start working. Osteoblast will start making this matrix. You can see here this pale yellow matrix that has formed. Okay. Here under this pink peach area, that is a good bone. Okay. On top of that, you can see a matrix that has been formed. It is empty. Okay. It does not have any dots, means it is not having any minerals yet. Okay. So osteoblast activity is the matrix formation, bone matrix formation. Inside this matrix, you know what is a matrix? Like rows and columns, okay? So very, very similar to that, a network of very compact spaces. That is the matrix, okay? So inside the matrix, calcium ions, magnesium ions, phosphorus ions will have spaces to go and accumulate. That's how the bone gets strong. Okay. But now it is not that strong because matrix is soft. Okay. So osteoid has been formed. This matrix, another name for this matrix is osteoid. Okay. And it is because of the osteoblast, this osteoid matrix have been formed. Okay. Coming to the next step. Now slowly, based on your diet, this matrix has to get filled up with calcium. Okay. Calcium, phosphorus, magnesium. Okay. Your bones are not just made up of calcium. There are other minerals in your bones as well. Okay. So mineralization takes place. This empty matrix, this empty yellow matrix you see, that osteoid will get filled with minerals. Once it is getting filled with mineral, it's no longer an osteoid. It's a new bone. You can see here the difference, okay? Osteoid tissue, the matrix tissue is empty. But the new bone formation which has got minerals in it, it is called new bone. Okay, the matrix which has got minerals in it, it is the new bone. New bone, and it slowly fills up from down to top. It will fill up, and it will become a complete bone in the resting phase. Again, when the blood calcium level goes down, osteoclast will be triggered. They will take up the calcium. They will dig a hole in the bones, give the calcium into the blood. Osteoblast will come into the place where there is an emptiness. They will start making the matrix. Once the matrix is ready, mineralization will restart. Okay, once the mineralization has been done, it's a new bone, and then again in the resting phase. So this goes on and on. Okay, till your last breath, this bone formation goes on and on. But when you are young, this takes place at a very accelerated phase. When you're getting older, the bone formation slows down, but the bone demineralization is fast. So you will have a lot of bone matrix and empty spaces. But to get those spaces filled up, okay, that becomes very slow. Once accelerated aging process kicks in, that is after your mid 40s and all, okay, this bone formation process goes down. Okay, this is how bone formation takes place. Is it clear to all? In children, during the growth and development time, the long bones of the body, like your femur, okay, femur, tibia, all these long bones of your extremities, okay, they have an accelerated growth, accelerated bone formation. That's why children grow up in height. Okay, the tip of the both bones, okay, they have a rapid mineralization. That's why it increases in height. The child will increase its height. That is also the children's height that is growing. The children growing up height wise is also an accelerated bone formation. Okay. So tooth formation, that's another function of your calcium. Just like how bones are mineralized, even your tooth is also mineralized. When a mother is pregnant, at that time itself, the fetus's teeth mineralization will start. Okay. And once the fetus is out of the mother's womb, about 6 months of age, slowly the mineralized teeth will start to erupt. Okay. So based on the mother's calcium levels during her pregnancy, the kind of calcium she was taking during the pregnancy, that will ensure will the child have a strong teeth or not, the milk teeth. Okay, and when the child is being exclusively breastfed, okay, weaning diet has been started. Okay, now based on the nutritional levels and calcium levels of these breastfeeding and weaning diet, that will determine the health of the child's permanent teeth. Okay, so the first form of mineralization, the first time your milk teeth was getting mineralized, it was when humans are in a fetal stage inside the mother's womb. Okay, the first stage of teeth mineralization takes place during pregnancy when the fetus is growing, developing. Okay, the second phase of teeth mineralization, now your permanent teeth also has to be mineralized before it the milk teeth goes away and the permanent teeth takes over. So that mineralization takes place after 6 months of age. Okay, based on exclusive breastfeeding as well as weaning diet. Okay. Next is for growth and development. If there is starvation, malabsorption, okay, any any nutritional diseases that children may suffer from, okay, that will lead to growth retardation. The child will not be able to reach their potential height, okay. So for growth and development, calcium is required, and also calcium is required for the production of growth hormone as well. Then for blood clotting, as a cofactor in blood clotting has a lot of factors, okay. There are around 13 to 14 factors involved in blood clotting, okay. Calcium is one of it, okay. Then contraction of muscles, not just your skeletal muscles, but even your heart muscle, okay. Your muscles, if you want to move your body, your muscles need to move, calcium is required, okay. And also the contraction of your heart muscles, calcium is required. Intracellular messenger in form of nerves to carry messages between your brain and every part of your body, calcium is required. It also helps your blood vessels to push blood, okay, to keep the blood moving in your blood vessels. Calcium is important. And also to release hormones, okay, for the production as well as the release of hormones from various glands, calcium is required. So in the absence of calcium, hormonal imbalance, nervous disorders, okay, skeletal pain, muscle pain, joint pain, okay. In children, growth retardation, dental caries, dental cavities, okay, these things will happen. Based on the functions, you can understand what will happen because of the deficiency of this nutrient. And it also helps in the absorption of vitamin D. In the presence of calcium, vitamin D gets absorbed more, and it's vice versa, okay. In the presence of vitamin D, calcium also gets absorbed much better, okay. But in the presence of iron, calcium will not be absorbed because they are conflicting in nature. Contact inhibition is the way how your cells proliferate, okay, because of the calcium levels in your body, okay. Many cells which can turn cancerous will not turn cancerous, okay. It will make sure that at certain level the cells have to stop growing, okay. As soon as when the cells come in contact with each other, it has to stop growing. Otherwise, if the normal cells do not stop growing, it will lead to tumor, okay. It will lead to hyperplasia and all. So contact inhibition is when two cells come in contact with each other. When they touch each other, they stop growing, okay. So because of that, there is a equilibrium. The cells know when to stop growing, and calcium plays an important role in that, okay. Because in the absence of calcium, even if the cells come in contact with each other, they do not know when to arrest the growth. They keep on growing, and that could lead to tumors and cancers, okay. Action on heart, as I mentioned earlier, even your heart muscles, if they need to contract, calcium is required, okay. Calcium-based electrolytes are also given, calcium channel blockers, okay. These medications are used to control your blood pressure, okay. Calcium channel blockers are used. It's a cardio medicine, uh, usually prescribed in patients who have angina pectoris or chest pain and hypertension. Okay, in these patients, calcium channel blockers are given that can block the receptors that receive calcium ion, and it will help in the heart to contract. Okay, but when a person is suffering from angina pectoris or hypertension, you do not want the heart to contract overly. Okay, you want the heart to contract enough. You want to control the degree of contraction of your heart. Okay, when the cardiac output is too much. Okay, in these cases, calcium channel blockers are prescribed. Okay, that will block the function of calcium. Otherwise, the normal function of calcium is to go and attach itself to the calcium receptors in the heart muscles and enable the contraction of heart. Okay, so that is the normal function of calcium. Membrane integrity and permeability, the cell wall. Okay, cell wall. How much water, how much electrolyte should enter or leave from your cells to maintain that equilibrium? The presence of calcium controls it. It makes sure, calcium will make sure that the cell wall, the cell membrane is not poorly maintained. Okay, it is strict with how much water, along with water, the electrolytes also come and go out of the cell. Okay, to have a control over it, calcium ions are important. Okay, activation of certain enzymes, various enzymes produced in the body, even without the presence of calcium, these enzymes will not get activated. Okay, enzymes can stay latent. Okay, as well in your body, and usually these enzymes are oxide synthase enzymes. Okay, some nucleotide synthase, usually required for your DNA health, RNA health, genetic health. Okay, coagulation factors. Many enzymes require calcium ions as a cofactor, including the blood clotting factors. So enzymes that help in your blood to clot, that also require calcium. So these were the functions of calcium. Is it clear to all? So next is the absorption. Next is the absorption of calcium, how the calcium is absorbed from your intestine. Okay, majority of the calcium absorption takes place in the jejunum part of your small intestine. Okay, so this is one enterocyte. Okay, this entire thing, just imagine this as one cell of your intestine. Okay, the cells of your intestine has these special channels called the TRPV6. Consider this as a tunnel, which the tunnel only calcium can use. Okay, only calcium has the access to get inside this tunnel, no other nutrient. Okay, so PV6, it stands for some transient potential. Okay, it's something that that's the full form of it. I forgot the full form of it, but TRPV6 is the name of the transient potential channel for calcium. One second, let me just, the transient receptor potential. Okay, that is the channel name. So TRPV6 is a calcium channel which is present inside your inside the cells of your, the lining of the enterocyte, intestinal cells, they have this specific potential channel through which the calcium ions can enter. Okay, even after entering, the calcium cannot just casually walk around. Okay, it requires a protein, and this protein is called calbindin. It's a protein that binds onto calcium. From the name itself, you can understand calbindin, calcium binding protein. Okay, so calcium binding protein, when the calcium ion gets attached to this protein, it becomes calbindin, and it can help the calcium move across from one end of the cell to the other end of the cell, to move across the cell and get exchanged with the magnesium. Okay, and then once the blood circulation will give magnesium inside, using the same enzyme ATPase, calcium will get out of it. Okay, magnesium goes into the cell, calcium comes out of it. During this exchange, blood gets its calcium ion, and from the blood, these calcium ions will go and settle down in the different bones, wherever the calcium is required, wherever mineralization is required, bone mineralization is required, that the calciums will get stuck in the bone matrix. Okay. So this is how the calcium is getting absorbed. Yes, somebody has put the full form here. Transient receptor potential cation channel 6. That is TRPV6. So is it clear to all how calcium is absorbed and transported? So you require three things here. One is the channel through which the calcium can enter. Then this protein, calbindin, through which the calcium can move across this cell. Okay. And with the help of ATPase, that's an enzyme. With the help of ATPase, magnesium is pulled in, calcium is pushed out. Okay. Favoring factors for absorption. First, as I mentioned, vitamin D. In the presence of vitamin D, or eating vitamin D rich food and calcium rich food together, okay, you can enhance the absorption of both. So vitamin D, you will find it in all non-vegetarian food, in milk. In vegetarian sources, you will not get vitamin D. So drinking milk is a good source of calcium and vitamin D because naturally both of them are present. Okay. Or any food rich in vitamin D, if you combine it with calcium rich food, like if you're a non-vegetarian, if you're eating chicken, okay, and you are putting some sesame seeds still, okay, you're drizzling sesame seeds over your chicken, okay, that's a good source of vitamin D as well as calcium. Okay, so these kind of food combination. And vitamin D also helps in maintaining normal blood calcium levels. Okay. So in the absence of vitamin D, blood calcium levels will also go down. Your bone will get demineralized. Okay. So vitamin D plays an important role in strengthening your bones. Then you have the acidic environment, acidity of your digestive mass. That means the food that comes out of the stomach, it is getting mixed with hydrochloric acid. So definitely the food that comes out of the stomach into the duodenum is very acidic in nature. So that is the acidity of the digestive mass. Okay. So if you suffer from certain disorders in which hydrochloric acid is not produced enough in your stomach, that would lead to reduced calcium absorption. Okay. And if you are taking calcium supplements along with any lime juice, okay, orange juice, something that is acidic in nature, that can also help in absorption of calcium. Then lactose. Lactose is found in milk. Okay, that's a glucose, that's a carbohydrate that is found in milk. That also helps in the absorption of calcium. So how lactose affects, lactose is used up by the intestinal microflora, bacteria in your intestine. They will use up lactose to form lactic acid. Okay, so lactic acid, again, it's acidic in nature. It will lower the pH of your intestine. So when calcium enters this low pH intestine, automatically the absorption increases. Tea and coffee will reduce the absorption of calcium. Okay. Then protein. If you're eating a protein-rich food along with calcium supplements, it enhances the calcium absorption, as well as phosphorus. Okay. Usually a lot of calcium supplements that you find, it comes chelated with protein molecules, okay, certain amino acids. So it is formed in such a way that naturally the body can absorb it easily. I'm talking about the supplements, okay, not about the calcium source of food. For example, lysine, arginine, these are amino acids that can increase the absorption of calcium. The need for calcium. If your body has a higher requirement for calcium, automatically calcium absorption will also be high. For example, in case of teenagers, there is a hyper need of calcium in children during the growth and development phase. Children requires good quality calcium, high amount of calcium. During lactation, okay, even not even during the pregnancy, but it is during the lactation, mothers require the highest amount of calcium in their diet. So there is naturally a physiological need for calcium, an increased physiological need for calcium. So when your body is in these states, these growth and development state, or for women, if you're in the lactating phase, okay, pregnancy, young girls who have just started menarche, okay, naturally your body is in a state of higher calcium requirement. So automatically absorption rate will also be high. Then one more factor is their exercise. Okay. The more you exercise helps in the absorption of calcium as well as vitamin D. Okay. Factors depressing the calcium absorption: oxalic acid, phytic acid. Okay, you find these in spinach, chocolates, dark chocolates. Okay, they are high in oxalic acid. Phytic acid you find in whole grains and high fiber food. Okay, whole grains, not the refined one. Whole grains have phytic acid. Legumes, okay, they all have phytic acid. So when if you're using whole grains or whole rice, if that you're using in your food, make sure that you wash them properly at least 3 times, and you have to soak them. Okay. For rice and all, at least 1 hour if you're soaking, that's enough. If you're using legumes, pulses, at least for 3 to 4 hours. The bigger the size of the legume or pulse, more will be the hours required. Okay. Maximum 12 hours you can soak rajma. Okay. These are the legumes that are quite big in size. Okay. The bigger the size of the pulse or the legume, more you have to soak them. So when you soak them and throw that water, don't use that water. Okay. Throw that water, wash it again, and then use it for cooking. So you can take care of the phytates, phytic acid. Okay. Oxalic acid you find in spinach. You wash the spinach thoroughly, but don't overwash it. Otherwise, you will lose the vitamin C. Okay. So oxalic acid, phytic acid will stop the absorption of calcium, or they will, what they do is, if you're having calcium rich food with oxalic acid or phytic acid rich food, what happens is it uh, makes a precipitate in your intestine. Okay, when oxalic acid reacts with calcium, it makes calcium oxalate, calcium phytate. Okay, these are the byproducts of this reaction, and these are precipitates. They cannot dissolve, and one that cannot dissolve cannot be absorbed, and they are removed from your body as it is through your intestine. Okay. So when it comes to palak paneer is a healthy dish. Okay. You don't have to worry about palak paneer because it has spinach, which has oxalic acid, and paneer that has calcium. Reason being, the amount of calcium and the amount of oxalic acid, okay, it's not on a very high range. Okay. The amount of calcium is quite high in palak paneer as compared to oxalic acid present in it. Okay. So the number of precipitate that will be formed is way too less, way too negligible. Okay. So that does not make palak paneer a bad dish. Palak paneer is a good, healthy dish. Okay. You get enough amount of iron and calcium. Okay. Because in one go, you are not eating 5 to 6 servings of palak paneer. Okay. You will hardly have 1 to 2 servings of palak paneer in one serving. Okay. Along with some grains, chapati, rice, whatever. Okay. So what is happening is neither the iron content, okay, or the calcium content in 1 or 2 serving of palak paneer is not more than 300 microgram. Okay. When the calcium in one dish is more than around 300 microgram, that's when the iron absorption will not take place. Okay. But when you have one serving of palak paneer, definitely the calcium content of that one serving or 2 serving is not more than 300 microgram. Okay. So definitely the calcium content of that is less than 300 microgram. It will help you absorb your iron as well as your calcium. Okay. It will not fight with each other. Only when the calcium levels are high, for example, if you have a glass of milk, okay, um, full cream milk, a glass of full cream milk and all, full glass of milk, okay, 500 ml of milk. That's when the calcium levels are quite high, and that will uh, affect the absorption of iron. Okay, so you don't take iron tablets with milk. Is it clear to all? Yeah, even in case of cereals, throw the water out. If you're using whole grains, if you're using whole grains, then throw the water out. Nutrient content will not get affected much because pulses and legumes, they have this thick coating. Okay. If you see, the fiber coating is there in the pulses and legumes, that will just help uh, the the body of the pulse to soften up so that it can be digested and you can use the minerals. Only when you don't soak, then when you don't soak your pulses or legumes, they still have that thick hard body mass which cannot be broken down by your intestine in sufficient amount of time, and there is a reduced absorption of nutrients. Okay. Soaking the pulses and legumes helps in absorbing the nutrients. It does not apply for nuts much. Okay. Then steatorrhea, this is the condition in which your body is not able to absorb or digest lipids at all, fat. So all those fat will be lost from your intestine as it is. Okay. You will lose a lot of big globules of fat from your excreta. That is steatorrhea. There is diarrhea as well, very watery excreta, okay, watery feces, and that has a lot of fat mass in it. That is steatoria. So steatoria will not just affect calcium absorption, but it will affect all your nutrient absorption. Okay. Then emotional instability. If you are stressed, okay, if you're undergoing through some mental health disorders, okay, and say you're anxious, stressed, depressed, okay, these can also have a negative effect on your hydrochloric acid in your stomach. Okay. When you are going through some heights of emotions, the stomach acid production will lower. Okay. That will lead to malabsorption of calcium. Increased GI motility, that is, if you're having high fiber diet, more than that is required, more than 40 50 grams of fiber in your diet. Okay, that will not just allow calcium to absorb, it will not allow any nutrient to absorb. Too much fiber is bad for your health. Lack of exercise, that will lead to decreased amount of vitamin D as well. Aging, with aging, automatically the calcium absorption goes down. And caffeine, as I mentioned earlier, caffeine, tea, coffee, coke, okay, drugs like anticoagulants, if you are on steroids, cortisone, thyroxine medication, okay, you have thyroid issue, levothyroxine has been prescribed. These will reduce the absorption of calcium from your body. Is it clear to all? Factors that help and depress calcium absorption. Metabolism of calcium. So it is transported by blood to the extracellular fluids. Okay, that is the fluid between your cells, outside the cells, not inside, extracellular fluids. Okay, from the blood, calcium ions. It is just osmosis. Okay, from higher concentration to lower concentration. When blood has calcium, blood has more calcium as compared to extracellular fluids. To create that equilibrium from higher concentration, the calcium will move into the extracellular fluids that do not have calcium. Okay, then extracellular fluids are very close to the cells as compared to blood. Okay, so from the again because of osmosis, calcium will go inside the cells which does not have calcium from the extracellular fluids. Okay, so 99% of calcium is reabsorbed in the kidney. When blood goes through the kidney for filtration, okay, kidney will pick up calcium to be used again later. Okay, so kidneys will not dump calcium into the urine. 99% of calcium that comes to the kidney is reabsorbed, is sent back into the blood circulation to go and mineralize the bone. Okay, kidneys will not allow calcium to be thrown out of your body via urine. 99% of it is reabsorbed. Just 1% of it gets filtered out. Okay, and most of this will go to calcifying your bones. Whatever calcium your kidneys are reabsorbing, it goes back into your bones. That is the metabolism of calcium. Coming to hormonal control, parathyroid hormones, they also increase the absorption of calcium from the intestine. Okay, but parathyroid hormone, when they are triggered, they go to the bones and they empty the bones out of calcium. Okay, because parathyroid hormones want your blood to have calcium. Okay, and it also because parathyroid hormone wants your blood to have enough amount of calcium, it will tell your intestine to absorb more calcium. So parathyroid hormone, if you have well functioning parathyroid gland, your intestine will readily absorb calcium. Okay, so whenever the blood calcium level goes down, it's the parathyroid hormone that gets activated. Okay, it will tell the intestine to absorb more calcium. It will go to the bones and it will empty the bones from the calcium out of the bones put it into the blood so that the blood gets its due calcium ions. Then calcitonin, which body organ secretes calcitonin? Any idea? Calcitonin is also a hormone. Yes, it's your thyroid gland. Calcitonin is secreted by your thyroid gland. Okay, thyroid secretes T3, T4, and calcitonin. Okay, so calcitonin, it opposes the parathyroid hormone. Okay, they both conflict each other. Parathyroid hormones want calcium out of the bones in the blood. Calcitonin, on the other hand, wants the calcium back inside the bones. Okay. So if parathyroid hormone is getting hyperactive, there is calcitonin. Nature has its balance. Okay. Whenever parathyroid hormone gets hyperactive, thyroid will take care of it. When parathyroid gets aggravated, thyroid has its techniques to take care of it. Okay, so they both oppose each other. One will increase the blood calcium level, one will decrease the blood calcium level. Okay, both will work hand in hand to create an equilibrium. Okay, so calcitonin will lower the calcium levels in your blood, but not from your bones. Okay, it will directly go and inhibit your osteoclast. If you remember osteoclast, okay, osteoclast are the one who are breaking down your bones. Okay, they are digging down your bones, taking the mineral out of it, dumping it into the bloodstream. That's what osteoclast do. So calcitonin will stop osteoclast from working. Okay, so there is no more damage to the bone, no more digging into the bones. Then vitamin D. Which form of vitamin D acts as a hormone? Previous class students, if you can remember. Which form of vitamin D? There is a name to it. It's not D3. D3 is pre-vitamin D3. It's not even cholecalciferol. Yeah, it is 125 dihydrovitamin D. Okay, that is the form of vitamin D which acts like a hormone. Okay, so whatever forms of vitamin D has been formed, okay, the inactive form, the pre-vitamin form, which goes into your liver, it becomes 1-hydrovitamin D. Okay, then it becomes 1 2, when it goes to your kidneys, that's when it becomes 125 dihydroxy vitamin D. Okay, or another name for it is cholecalciferol. Okay, so that is the form of vitamin D that acts as a hormone, not the other names that you have mentioned above. Vitamin D has different stages in your body. Okay, only the final stage that comes out of your kidneys is the one that functions as a hormone. Okay, so vitamin D also plays a very important role in your calcium absorption. Okay, it is required for your intestine to absorb calcium as well as phosphate. Okay, from the intestine to the bloodstream. Okay, it has to go, means vitamin D is required. That is the main function of vitamin D. Not just calcium, but also for the absorption of phosphate. Then you have cytokines. So they are a part of your immunity. and they are secreted by your uh, uh, the cytokines. They secrete certain chemicals which indicates, okay, the T cells, the B cells in your immunity to come to this site. Okay, here there is an invasion of infection. Okay, and to do the work of immunity, they produce certain chemicals. Okay, cytokines can also change your intracellular calcium levels inside the cell. Once the calcium is inside the cell, okay, then it is cytokines' responsibility to rectify the levels of calcium. Okay, how much calcium should the endoplasmic reticulum use? Okay, how much calcium should the other parts of your cells use? That is taken care of by the cytokines inside the cell. Okay, but the other function of cytokine is to signal the T lymphocytes and the B lymphocytes where an infection is, where an invasion is, which cell is damaged. Cytokines will give the signal. The T lymphocytes and B lymphocytes will come there and do their work. But inside the cell, if the calcium levels need to be controlled, cytokines are the ones that are responsible. Is it clear to all? Next, hypocalcemia, hypo less, calcemia, calcium in blood. Okay. So it's a condition in which blood has low levels of calcium. Okay, either because of lack of vitamin D, not having enough calcium in your diet, okay, or any hyperactivity of your parathyroid gland, okay, or if your parathyroid glands are not functioning properly, that can also lead to hypocalcemia. So there will be muscle cramps, confusion, tingling sensation in your fingers, in your lips. You may get cataract, okay, osteoporosis, tooth decay. Okay, these things can happen when somebody suffers from hypocalcemia. Then hypercalcemia, opposite of it, too much of calcium in blood. Okay, again, if your parathyroid glands are overactive, if you are undergoing calcium toxicity, okay, this can lead to too much of calcium in your blood. So the symptoms for hypercalcemia, and it can also give you calcium stones. Am I audible? Is my screen visible? So the signs and symptoms of hypercalcemia, increased thirst, increased urination, okay, high levels of calcium in your urine, which is not supposed to be, calcium stones, stomach pain, nausea, vomiting, bone pain, muscle weakness, confusion, okay, palpitations. Remember, calcium helps in contracting your heart muscles. When there is too much of calcium, too much of heart contractions will take place. That is heart palpitations. It's like you can feel your heart beating on your chest. That is palpitations. Okay. Regularly, you faint, high blood pressure. Okay. These are the signs and symptoms of hypercalcemia. RDA, normal amount of calcium that one should take, is about 1000 mg per day for adults. Even for teenagers, for children, it's almost the same. Okay, 1000 mg of calcium per day. For lactating women, it is 1200 mg. Pregnant women also 1000 mg of calcium per day is enough. But if you're lactating, 1200 mg of calcium per day. Hypocalcemia, less amount of calcium in your blood. If your parathyroid hormones are not functioning, or if your thyroid hormones are over functioning, okay, that could lead to hypocalcemia. Some intestinal obstruction, malnutrition, that could lead to hypocalcemia. So calcium rich food, oats, okra, that is bhindi, lady's finger, gingerly seeds, sesame seeds, green leafy vegetables, almonds, banana, oranges, chia seeds. Okay, these all are calcium rich food. Milk as well. But apart from milk, if you're vegan and all, these are the other options you can have. Cheese, yogurt. In non-vegetarian sources, you have sardines. Okay, small fishes. Small fishes are good sources of calcium. Parmesan cheese is a type of cheese which is good in calcium. Yogurt, curd, salmon, sardines, mackerels, some beans and lentils as well. White beans. Whey protein powder, if you're using whey protein powder, that can also come fortified with calcium. Green leafy vegetables like collard greens, spinach, kale, amaranth leaves as well. And there are different fortified food cereals, milk powders, children's meals, okay, milk mixes, malt mixes available, okay, ragi, which is a millet, finger millet. The flour that you get from outside is fortified with calcium. Amaranth, okay, amaranth seeds, amaranth leaf as well. Tofu, fortified drinks, fortified plant-based milk. Okay, I have always mentioned if you are using plant-based milk, go for the packaged one because it comes fortified in calcium, vitamin D, vitamin 12 and all. Next, coming to phosphorus. Functions of phosphorus, again, phosphorus also helps in strengthening your bones and teeth. Okay, it maintains your energy levels. It also forms your genetic material, health of your DNA, RNA. Phosphorus is important. Also helps in forming the membrane of your cell walls. Okay, cell wall is made up of phospholipids. Phospholipids. So it is made up of a fatty layer which has a phosphorus ion attached to it. So your cell membrane walls are made up of phospholipids. Okay, so for each and every cell in your body requires phosphorus for its build. Okay. Then it helps your brain healthy. It and also your nervous system healthy, just like calcium. Phosphorus also has a function of sending messages between the brain and other body parts. And it also helps in maintaining a normal acid-base balance in your body. It also helps in oxygen being delivered to your cells in the body. Okay. It's a process called as oxidative phosphorylation. Okay, in which ATP or ADP, that is the energy that your cell makes. Okay, so phosphorus also has a role in making sure that oxygen is being carried by the hemoglobin that gets deposited in the cells. Okay, because adenosine diphosphate, adenosine triphosphate, okay, these are the energy currency of your cells. Okay, adenosine triphosphate, ATP, when it breaks down, it gives one phosphorus away. That's when energy is produced. Adenosine triphosphate, three phosphate ions. It breaks down into adenosine diphosphate. Okay, so one phosphate ion is released. That's when energy is produced. Okay, so for energy production, oxygen is required in your cells. Okay, so it is because of phosphorus that energy is released, oxygen is used up, and energy is released by your cells. So these are the main functions of phosphorus. So intestinal phosphorus absorption, how does the phosphorus get inside the intestine? There are two ways, okay? If you can see here, these are two cells of the intestine, okay? In between the cells, without any channels, phosphorus can directly get inside your blood, okay? It bypasses the cells. It does not have to enter the cell, intestinal cell, and go into the blood, okay? If there is a small space between two cells in the intestine, through that itself your phosphorus can directly get into the blood vessels. Okay, this is a passive way of transportation between the cells, paracellular, okay? And this happens when the intake of phosphorus is very high. You have really high intake of phosphorus, that's when this kind of passive transportation takes place. Okay. Active transportation, when the phosphorus ion actively enters the intestinal cell through various channels. Okay. And it also makes use of the calbidin that the calcium uses to pass through the intestinal cell and get into the blood vessel. Okay. So that is the active transport. Am I audible to all? Am I audible now? So these are the two main transports of phosphorus between the cells without getting absorbed between the cells directly into the bloodstream. That is passive, paracellular, and actively they go inside the cells through various channels. Okay. And they also take the help of calbidin. Calbidin is also the same protein that helped calcium to move across the cell. The same calbidin will help phosphorus as well to move across the cell and go into the bloodstream. Is it clear to all? Both calcium and phosphorus will take use of calbidin. So again, phosphorus also get reabsorbed just like calcium. Okay, blood will go to various organs. Okay, it will be used up by various organs, and again it will go into the kidney through the blood circulation. Kidney will reabsorb as much as possible calcium back into the bloodstream. It will go and get deposited in the bones again. From the bones, it will be taken away because of parathyroid hormone. Okay, it will go to the kidneys through the blood. Kidney will take up all the phosphorus, put it back into the bones. Okay, so this thing goes on and on in a loop. So RDA of phosphorus is again 1000 mg per day for adults, just like calcium. But during infancy, okay, when you are an infant, the phosphorus requirement is higher as compared to calcium. Okay. If you are having 500 mg of calcium, you need 500.5, okay, 750 mg of phosphorus during infancy. But by childhood, by once you're toddler age and all, okay, your calcium and phosphorus requirement is equal. Okay, only during infancy, infants will require higher amount of phosphorus as compared to calcium. Can you guess what would be the reason why children during infancy require more phosphorus? Any guesses? Any guesses why infants will require? Growth rate is also high in childhood. Calcium will help in growth rate. Why phosphorus is required more? Calcium will also help in growth. Yes, it is because of cell formation. Each and every cell in your body, each and every cell in your body, it requires phosphorus. DNA synthesis will take place once the cell is formed inside the nucleus. Only the cell, if it is formed inside the nucleus, DNA will be there, right? So based on the role that phosphorus has to play, okay, in infancy, the child does not grow on the basis of their bone weight, okay. There is a high rate of cell proliferation that is taking place. More number of cells are required to grow within that age group, okay. So for that, phosphorus is required. Sources of phosphorus: non-vegetarian, all forms of fish, meat, poultry, milk, they are enough. They have good sources of phosphate. Plant products like sunflower seeds, all forms of nuts, whole grains, okay, they are also great sources of phosphorus. Then magnesium. Magnesium as well is all found in your hard tissues, just like your calcium and phosphorus. It is also found in your skeletal system. It is important for your cellular metabolism, okay, the way how cells use up oxygen and give out carbon dioxide, that is cellular metabolism. It protects your heart. Magnesium is good for your heart health. And it's very similar to calcium in various functions. And people who suffer from asthma and all, magnesium is used as an antagonist to calcium, because too much of calcium, it can produce that bronchospasm. Bronchospasm means your trachea, your windpipe is getting is contracting and the airway is getting smaller and smaller. So magnesium can help in relaxing it. Okay, magnesium will help in relaxing the cells, smooth muscle cells of your bronchi and your trachea. And it also has a lot of anti-inflammatory property. It is bronchodilator. It also has anti-inflammatory property. Deficiency of magnesium is very rare. Okay. But if any child is deficient in magnesium, it leads to hypomagnesemia, less amount of magnesium in blood, and that will lead to convulsions, apathy, cardiovascular diseases. So these are the sources rich with the magnesium: almonds, spinach, chocolate, cashews, white beans, quinoa, fishes, pumpkin seeds. So that's all for today. If you have any queries, mention